So I like meditation, mindfulness. Tai Chi is like meditation in motion. So it helps with some of that balance and strength training, but also like deep breathing, meditation that can, again, impact some of that mental health aspect of osteoarthritis. Sometimes talk therapy is really important to help get over some of the feelings of hopelessness that might happen in osteoarthritis, or replace like negative thoughts with positive thoughts, and just like coping skills of how to move forward. Because sometimes I've heard people say things like, what's the point, things like that. And that's, I think is really important to try and get over some of that through stress management. I like heat and cold a lot. I recommend that a lot. Sometimes people like one versus the other, but usually typically cold when there's like swelling. If there's like swelling in the knee, for example, an ice pack. If there's like a lot of stiffness, maybe heat might be better. But I always caution putting the ice pack or the heating pad in a towel so you don't burn your skin, because that happens too. If you put it directly and it's too hot or it's too cold, it can actually leave burns, and we don't want that. Rice, so raw rice is kind of like a cheap way of getting heat. Putting raw rice in a microwave, heating it up, putting it in a pillowcase, and then just kind of sitting your hands in there and letting the rice heat up the hands, for example. A paraffin wax bath is an option. There are mittens you can put in the microwave that you can use. So there's a lot of options when it comes to like heat and cold, but usually works really well too. And then pain medications. So Tylenol, I like Tylenol a lot. It doesn't work as well as ibuprofen or Aleve, for example, but not everybody can be on ibuprofen or Aleve because of kidney disease or, heart disease. And as we get older, I kind of worry about developing kidney disease if you haven't. It's okay to use ibuprofen-like medications once in a while. Tylenol you can use every day. So sometimes alternating both is also an option. And then depending on, what else is going on, duloxetine can be an option for pain. It is an antidepressant, anti-anxiety medication. And so if someone has anxiety, depression, and osteoarthritis, that could be a great option, for example, to use, because it's hitting multiple things at the same time. And then there's a lot of creams. There's a lot of salves that are options. So like Voltaren gel is really good. Bengay, Aspir cream, Icy Hot. Capsaicin is really good, but it's pepper. So it can be spicy if you use it on your hands and get it in your eyes. It may not be a good option for hand arthritis, for example. But they work. And sometimes one works for one person more than the other. It might take a little bit of cycling to figure out which might work for you. But those are options, and in combination with everything else has a role in management as well. And so joint injections are an option. We've tried all the other things that we've talked about, not really helping. We can inject the joint with a steroid. And usually, the common places that I usually inject, the knees are number one. It's kind of like in order of kind of what I do. The knees very commonly, the shoulders kind of the second more common, and then the base of the thumb too. So steroid injections are also an option. And people get relief. I have people who come back every 3 months because we can do them every 3 months because they have relief for 2.5 months and they like that. So they'll come back every 3 months to get them because in that time they have the quality of life that they're looking for, and it's worth it. As a rheumatologist, I do not inject the neck or the back, and that's where pain management comes in. So if someone has arthritis in the neck and the back and has tried physical therapy and all the other things we talked about, then referral to a pain management doctor would be appropriate. Supplements, that's a big question. I get this question a lot. Supplements, first of all, are not FDA regulated, and so we don't always know what's in them besides the actual drug substance. So that's one thing. A way to bypass that would be to look on the bottle. USP supplements are usually kind of what I would recommend, just being aware of where you get your supplements from. The other thing to be aware of is that supplements can sometimes interact with a lot of the medications you might be on. Most commonly blood thinners. Blood thinners interact with a lot of supplements. I put here the writing at the bottom is a website that has like a list of a lot of supplements and like drug interactions and things like that. That is a useful tool that you could refer to. But there's a lot of supplement. And then the other thing with supplements is that we're kind of behind the ball with them. We don't have a lot of evidence because we don't have a lot of studies that show that they're beneficial. But I always say if it's not harmful and it's helping, then absolutely. And there's no interaction with the medications, absolutely. So anything from turmeric to glucosamine to CBD oil to the ginger supplement, if it helps and there's no interaction with other medications, I'm all for it. Things that there's no real data for, pulse vibration and TENS unit, PRP injections. There's no data for it, but I will tell you based on experience, I've had patients swear by it. And again, if it's not going to hurt you and it helps, it's worth a try. Great. Okay. So just to summarize what we've spent the past few minutes talking about, osteoarthritis is the most common kind of arthritis everywhere. Really, it's not just the US, it's everywhere. It's commonly associated with a lot of other things. And so trying to combat that as much as we can indirectly help us take care of the other things like heart disease and diabetes. Because if you can move, then, we can get our blood sugars under control, for example. And then usually the management is not just one thing. It's a lot of things kind of coming together to work to get us to that point of the quality of life that we want. And that's the goal of treatment.